green room. I have the perfect opening, so
you might already be.
Oh, good. No, listen, I almost didn't make it here on time because my steam shower is finally complete.
Yeah.
So for those of you who follow me on, Facebook, I started a debate, which I thought was going to generate a little bit more from the old days. This whatever dry sauna or wet steam.
Are we live? We are live. Okay.
Oh, good.
Good morning, everybody.
We're in the
Welcome to
green
another
room.
green
Great.
room, and
Yes.
we're talking saunas this
Well,
morning.
we are. I was talking. I almost didn't make it on time because any project, anybody that's doing a home remodeling project these days knows that anything that was supposed to take a month or 2 months has been well stretched out. So I had a great idea, and it's the debate: wet steam or dry sauna. You know, in the old days, and I always remember on Saturdays, we would go to the Akron Jewish Community Center, and the health club was open for the fathers to bring their sons.
Nice.
It was great. And we would sit in the schwitz, which was the wet Turkish steam sauna. So my project is done. I was sitting in the sun, my wet steam shower this morning, and I feel great.
You feel good.
Listen, we have an unbelievable guest this morning in the green room.
We do.
And I want to introduce it's Cher Kaiser, who, listen, is a behavioral specialist, which in this day and age can take a lot of definitions. We should have had you in the White House, maybe right next to that dining room.
Oh, that would be
behavioral specialist. Can you imagine? How good are you, Sharon? And so many years of taking care of many autistic patients and others.
Yes.
And catching those plates of food that may be thrown up against the wall. You know, maybe you could have grabbed one. Before
I have quick reflexes for sure.
Anyway, listen, Cher is expert at many things behavioral, but her work in the autistic field and in autistic spectrum disorder, well known here in Sarasota, the Sarasota area. I know I want you to talk about the Haven more so than I'll discuss it, but a fantastic role with really helping many families with their special needs kids. And, you know, listen, we talk about it all the time. And, you know, we always do a little politics, Cher, as we were talking before we got on. You know, it's funny how freedom of choice, is interesting when you decide the issues that you want to have your choice about, right? Mm-hmm. Choice to own a gun that can kill. You know, there were the hearings yesterday were interesting. You know,
I didn't hear them.
Oh yeah, no, there was an assault weapon ban, hearing and. Oh, for sure. And families got up and this and that. And literally the gun manufacturers were put on the line. And, you know, it's kind of interesting because a lot of their money comes from military contracts. Rudy, you could speak to that.
Oh, yeah.
So if you have a military contract that's set in with the government to produce this weapon and make this, why should you be allowed to also sell that weapon to the public?
That's the only thing. Like, I mean, I understand military because like I said, I'm a military contractor myself. So military is military. You use it for weapons against, your foes. And these people who use the weapons are trained on these weapons. And they're not going to fire an AK-15 or, at anyone,
But just to cue it up for Cher, and Cher and I are fierce Facebook friends and proudly so. And I know you believe in the progressive agenda. And of course, the taking away of Roe. How can 150 congressmen be voting against the right for you to marry who the hell you want to marry in 2022, including that moron, who votes no and then goes to his son's wedding or whatever?
Yeah, ridiculous.
These people.
No,
so here's my point. In the autistic community, and I know you would agree with this, Cher. Every parent should have the right, to utilize the substances that are out there, and cannabis should not have to be the last arrow out of their quiver to assist their kids.
Absolutely. In fact, it should probably be one of the first. I mean, given the medications that I've seen among clients that I've had, and mind you, autism is a huge spectrum, so there are certainly kids that I've worked with and adults that I've worked with that are verbal, that are attending normal high schools, can go to college, that kind of thing. And then there are patients who are nonverbal. And obviously that would lend to a lot of frustration, and that can lead to behaviors. And that's kind of like where I come in. But because of some of these behaviors, which can be extremely both self-destructive, self-injurious, but also destructive to property in the household, out in public, and physically aggressive to other people as well. Again, this is not their fault, they are not able to communicate in the way that you and I are. And you can only imagine how frustrating that could be, for a lifetime, So
tell us about that, Cher, because I think there may not be an understanding exactly of what autism spectrum disorder is,
Yeah,
and
maybe you can give us like a little bit of a 101.
Yeah, kind of a primer, because of course every individual is different, right?
Absolutely.
But there's some innate pathology.
Absolutely. And as much as every neurotypical person is different, every neurodivergent person is different. And certainly within ASD, within the autism spectrum, like I said, you can go from being completely nonverbal and being and unable to care for yourself, to assume daily living activities, to toilet yourself, dress yourself, that kind of thing, to, again, going to new college and graduating new college, you know what I mean? Higher end autism spectrum, you wouldn't even necessarily know. And that is kind of one of the key components about autism, is even if a person is completely nonverbal, you would never know just by looking at a person. There are certain other developmental disorders, as we know, that you can kind of look at a person and tell, oh, this person probably has Downs, this person maybe has this or that. Autism is not one of those. And that's why it can also be kind of dangerous. I'm kind of veering off here, but when you have a 6'2" nonverbal kid who elopes, and that just kind of means runs away, into your home, and you're not that person's caregiver or parent or whatever, we live in Florida. There's the stand your ground law. You can get shot, you can get killed. We know that guy in, there was a behavior therapist down in Miami who was shot by a cop who was there just trying to calm his client down. His client had eloped out of the building. He went to go find him, found him, and then it was a black man, and he was sitting on the ground, hands up, saying, "Don't shoot, I'm a behavior therapist. This is my client. He's got autism." And the guy still got shot by the police. So, autism is, it's definitely something that needs to be treated early on. They call early intervention the key. So by the time your child is diagnosed with autism, which is typically around 2 or 3 years old, is when you first start seeing signs and symptoms, lack of eye contact, lack of speech, maybe where they had it before, and that sort of thing. And then the kind of, the behaviors go from there, and they're very diverse. They're very, it just kind of depends on where they fall on the spectrum. But it's definitely interesting. It's been around for probably, as long as we have, but just without the diagnosis, I mean.
Is it, but it seems like it's like on the rise, like a lot. Like, I remember growing up.
I speak to scary facts. I've been told 1 out of every 4
it's like
kids by 2030 might be an educational challenge due to their learning disabilities on the spectrum.
It's crazy.
However, wherever you want to put it.
Is there any science now behind like what's causing the uptick in autism?
So unfortunately, there is still no research, no valid research on what causes autism specifically. So there are a number of factors. Now, I am not one of those who's going to say vaccines have nothing to do with it. Obviously there are vaccine averse events, and it can happen with a person's body chemistry and that kind of thing. But I don't think by any means that is the case across the board. You know what I mean? I've had clients who were vaccinated who had autism, and clients who are not vaccinated who had autism. So I don't think that's the key there. Now it could be in some regard a kind of a combination of environmental factors and maybe neonatal factors and that kind of thing, body chemistry, all of those things together.
But I think a recognition too, Cher. It may not have been recognized as such maybe 40 years ago and diagnosed.
Well, back in those days, they would just send you off to an institution, and that would be that. And it wouldn't matter what it was, whether it was autism or Downs or any other developmental disability. You would just be put away, and that would be the end of it. And so that's kind of a large reason why we see it so much more now. We recognize it more because these people are not shipped off to institutions. They're more visible in the community. So we see them more often. What I mean?
Appropriate, of course. And anything that would restrict that, okay, just kind of pulling the politics back in, which I shouldn't. But it's fearful. It's fearful. And to think that the Republicans are going to protect the rights, okay, of the disabled, Okay, more so than the Democrats at this point, you know. I mean,
I mean,
I think we
there's
have to call it
no,
what we see right now leading into these midterms, you know, but I don't want to get too far away from it.
there's a huge battle right now within the ABA community with ACA, with DeSantis. He
Please.
basically cut Medicaid services.
Yeah,
So
a
now
lot.
there is a
So much better.
huge
Crazy amount.
subsection of kids with disabilities in the state of Florida, specifically some of these developmental disabilities, who are not going to get the services that they desperately need, which really, I mean, it makes no sense, because if they get that early intervention, and that's kind of where I come in and people in my field come in, if we get that early intervention, then by the time they are 22 years old, or to 22 to 26, when they come off of parents' insurance, they are relatively, or the goal is for them to be as independent as possible. That is our goal. We try to teach them to communicate in whatever way works best for them, and also how to function in their daily lives as best as possible. So at the very least, they would be able to live in a group home per se, again, kind of like the Haven, where they have one person or two people who are, who work there in the home, and then 6 to 8, depending on how big the house is, people, roommates or whatnot, but they can live, sustainable lives, have good quality of lives, but without this help, and with what DeSantis is doing, which is just, honestly, it's horrific. It's horrific. These kids are not, they're going to end up, who knows,
They're
like out
so
on the streets
pro-life.
or in jail.
Yeah, it
Yeah.
is.
Oh, I know.
That's what puzzles me about this, is just where their priorities lie. And, it's funny because people talk about Biden now and what's going on, and inflation, which I think, quite frankly, is almost primarily tied to Ukraine, and the Ukrainian war and the oil prices. And of course, coming out of COVID, and a lot it's a lot of different things. But what would the Republicans be doing now about it? What would they be doing different?
Nothing different, because it's
so I see, listen, Manchin finally kind of flipped over, and maybe there will be some things happening and whatever. But my point is, to think about the taking away of funding, okay, for those most in need. That's what so bugs me about those that will continue to follow this narcissistic idiot, okay, over the cliff, is that the policies are so draconian. And I'm troubled by it, but it's the dishonesty.
Well, because honestly, like, they always talk about, like, okay, intervention, and they talk about even for gun control, like, okay, well, we need more money put into mental health, behavioral. Well, and then they take away the money. So
right,
it's
that's
so
exactly right. They're talking out of both sides of their face, which is pretty typical of Republicans, unfortunately. But they definitely, they can say they're pro-life. We all know they're pro-birth. They're certainly not pro-quality of life.
No,
once that baby's born, forget about it. It doesn't matter whether it has special needs or not. They don't care. You better hope your mom doesn't need food stamps, because otherwise you're going to be, vilified for that. So
it is. It's the people on the margins of society. It's like they don't mind authoritarian as long as they already have theirs. When those 100%. Already have theirs, and the authoritarian wants them to maintain what they have, then we're going to, listen, we're going to see what we see. You know what I want to ask you, Cher, because you wrote a little bio piece that you sent to me, and I was struck by some parts of it.
Sure.
Talk to us about the pharma that you've seen that's been thrown at these kids, right?
Oh, for sure. So
and
there's
the effects, the side effects. And because people will tell you this, and then we'll talk about cannabis when it comes to helping, those on the spectrum. I am not, and I never will be, either or guy. Okay. I'm find that best balance guy. Right. And I tell that to my pain patients. I tell that to my cancer patients. I tell that to all my patients. You want to utilize the adjunctive benefits of the ancient plant in conjunction with what modern healthcare has to offer you.
Absolutely.
So a surgical procedure, or even an injection done it the appropriate way by the appropriate people. I always tell my patients, avail yourself of what's out there. So when it comes to my patients on the spectrum, I always tell parents, listen, you want to utilize the fantastic resources of your doctor, Dr. David Berger, of course, and others.
He does all holistic, which is awesome.
He does. So there's a lot of docs out there that are really well focused from the conventional healthcare side. And if you have a doctor you like and a doctor you trust, right, and conventional pharma has been helpful, then by all means continue to work along with that, with
Absolutely.
behavioral therapists like yourself. Believe me, thank goodness for the advancements, Sharon. I've seen the research that you've shown me. So you
Mhm.
guys take what you do seriously. You
Oh, for sure.
study the effects of what you do. That's why I was so anxious when we started to have some autistic kids in the practice, that I really connected with somebody like Cher who could advise me. So what have you seen pharma-wise that has come at these kids, Sharon?
Oh my goodness,
Effects, side
you name
effects?
it. You name it. There are several antipsychotics, that kids are put on, and I'm talking about kids as young as 4 and 5 years old, because again, to a large degree, we don't know the cause. And so doctors are kind of like shooting in the dark, you know what I mean? In terms of medication, they're just trying to throw whatever at the wall, see what sticks. I've seen clonidine, gosh, and name some antipsychotics. I can tell you,
Well, Remeron, I know Remeron
Reveron
will
for
pop
sure,
in
that's one
there,
of them.
and Seroquel and Trazodone.
Seroquel's been one. A
Of
lot of
course, your
some
benzo,
benzos.
your
Yeah, for
benzodiazepines,
sure.
your
Clonazepam, yeah,
Klonopin.
for
Right.
sure, for sure. But some of these are really, really heavy drugs. I mean, they are heavy drugs. They're not, they're not
But the
drug light.
behaviors, as
So
you say, but the behaviors can be dangerous. And especially when you get
absolutely.
into the puberty years and the
Oh, for sure,
hormonal
for
changes,
sure.
you have to remember
But I
these are
think,
kids that are
but
becoming
I
young
think,
adults.
but I think also like Dr. Berger, like one of the approaches he has is dietary,
Sure.
and he actually
Oh, for
looks a
sure.
lot at diet of
Well,
children.
there's definitely a huge gut-brain
Mhm.
connection for sure. That we
Yeah.
know. That is one of the things that is being looked at, researched, within the science of it.
Mhm.
Still, ABA, which is what I practice, applied behavioral analysis, is the most effective evidence-based treatment for autism. Yes, medication can be included in that as well, and certainly can have some benefits. But as far as the heavier pharma, can have a lot of drawbacks and side effects as well. And again, they're just trying to figure out, kind of, what's going to work, what's not going to work. Every kid reacts differently. I've had clients who would react in the complete opposite way of what the medication was supposed to do. So but I think that those drugs, while they have their place, and if nothing else works, then by all means you can work your way to that. But the way that ABA works, and I'm gonna explain this because it kind of is similar to my take on the drugs as well, is that we use what is called least to most intervention. Right. So if a client is capable of, let's say buttoning his shirt, then I'm not going to hand over hand have him button his shirt, right? I'm going to let him button his shirt. And then if he needs help with the zipper, then I'm going to hand over hand help him with the zipper, or her. You know what I mean? So that's
So
kind
if
of
they
what I'm
want to go
talking about.
top to bottom,
So,
or
right,
bottom to top, or every
right,
other button, or whatever it is in
right.
their
You
noggin,
just
right?
want to make sure that you allow them to do what they can do, and then you help them do what they can. So you're going to use the most prompts whenever they can't do something. So when they're learning a new skill, when it's a skill they already know, you're going to use the fewest prompts, the least prompts. So in that regard, I would think that medical marijuana would be your first, your go-to initially, right? Because it does have the fewest side effects. You can't overdose on it. You know what I mean? There are so many benefits to it. And I would consider it, the least invasive, so to speak, of all of the drugs that are used. You know what I mean? So it being natural, there are a lot of parents in the autism community who do, place blame on vaccines, and I'm not gonna, there's no judgment here on my end in terms of what parents feel or what they've experienced in that regard. But because of that, they all tend to be like Dr. Berger, like you mentioned. He has several clients who have autism disorder and other things, and a lot of the parents are very, very, natural, holistic. They want to go that route because of their experience with the vaccines. And again, a lot of those other medications are so heavy that it's hard to kind of justify putting a 4-year-old, I mean, granted, a 4-year-old who can put his head through a wall, on some of these antipsychotics, if you can use medical marijuana, to a same or better effect.
Do you find like the parents of some of the patients, are they more apprehensive about it, or are they pretty accepting of trying medical marijuana?
I think certainly over the years, so I've been in the field for about a decade, and over the years, parents have definitely become more open to it. I think as a society in general, we've become more
We
open
are,
to it.
yeah.
And so it kind of has coincided in that regard. The parents who are more holistic definitely are more open to it, I would say, because they are searching for something that can help. And they don't want to go that heavy pharma route right away, certainly, and if at all possible, avoid it. But I mean, let me tell you, I've had so many clients, not just clients, but when I was, behavior specialist at the Haven, I had students there whose parents would come in and give them their distillate, you know what I mean, at lunchtime or whatnot. And it was just really, it's amazing the difference in behavior and demeanor. And I mean, they're going from, 60 to 0 almost, you know what I mean? They're like full on having a meltdown behavior. And then within moments or within minutes, happy, not just calm, but happy. Like, and those that have the words to tell you will tell you that they feel happy, So it's really, it's a fantastic thing to see and watch. And I really just wish that more people, and again, that's why I'm happy to have the opportunity to work with Dr. Berry to get the word out. That this is something that we should really be looking at in this field, and for our clients and patients, so to speak, respectively, that it needs to be brought to the attention of lawmakers. It needs to be legal. It needs to be one of those things that kids can legally get a card for.
How does the world of autism though view it? Like in the sense of like, I know there's so many groups with, about autism now, like in societies for autism. How are they receptive? Are they trying to push it a little bit harder to say like we need it legalized, or are they still kind of like not there yet? Because I've seen like there's so many like moms for autism,
Well, for sure, we see it from the cannabis side as those that are working to get it included. Ohio just denied it. It is not, unfortunately, everybody here in Florida. Let's be clear. Autism is not on the list of qualifying conditions, but with Florida's unique wording of their law, similar likewise, or as comparable conditions to PTSD, right?
Certainly.
Right, of course, anxiety, depression, sleep disorder, obviously it's easy to document in pretty much every every autistic spectrum disorder patient. But Cher, I wanted to really back it all the way back to when you talked about the gut brain connection and PANS, which is a term that you hear about. And various food intolerance issues in autistic patients. It harkens back, Ruta, and you've heard me discuss this, as to whether autism may be a part of what's called endocannabinoid deficiency syndrome in general, which may have manifested in the population with migraine, headaches, fibromyalgia, irritable bowel
a lot of the
syndrome,
autoimmune,
right? A lot of the autoimmune diseases.
I mean, there's certainly a high rate of comorbidity, I would say, between autism and things like pandas and stuff like that's very hard to pin down, and oftentimes takes a long time to get a diagnosis for.
And that's why we can see a tremendous response in some of these patients because of the lack of endocannabinoids, and this has actually been documented. So let's talk research, because of course here in the States, it's impeded, still being under Schedule 1, which is a terrible thing. We really haven't seen much in Washington, although they're starting to talk about some movement, but there's just no political environment right now where Schedule 1 is going to be taken away. I just don't see it. I guess Biden could probably do it by executive order, but I don't know. It has to get through the Senate, anything legitimate, and that it's not going to happen. But my point is, there has been research in Israel and other countries that have really shown benefits, and they've actually drawn the blood of these autistic spectrum disorder kids and found a deficiency of anandamide and 2-AG, those chemicals that actually are active in the cannabinoid world. So we need more research. Everybody knows that. Listen, bringing the doctors on board, Ruta, and as you talk about those societies, that really do drive the buses, nationally, that's an effort that takes time. It takes experts like Cher, being out there kind of working on her side. It takes doctors like myself, because we've talked about it. Doctors only listen to other doctors. Politicians
That's a true story. That's a true story.
So
honestly, it's probably more the doctors who are more hesitant, to have their clients, get
That's
on
where I
the
was
medical
leading.
marijuana than the
Right.
parents. The parents are open to it, but then they take
Yes.
their kid to their general pediatrician, and the
No, and
guy's like
pediatricians
80
are
years
not,
old, and he's like,
So
they
"Oh
are
no,
not,
no." Yeah.
oh my gosh, we fought this poor woman, like one of our patients, this poor woman comes in and she's so desperate because her child had, severe autism, and the pediatrician was like, if you bring your child to go give it, you can just wipe us out. They wouldn't
Right.
do anything, no medical records. They were like, we are never gonna allow your child to go on medical marijuana. So it's
right.
it depends. You're right.
No,
It's
so
a lot
that's a
of
terrible thing.
physicians.
So there's a fantastic Facebook group that I always like to promote, Whole Plant for Whole Plant for Autism. I don't know, I'm probably even messing it up right now.
I think it's a whole plant for autism access, but yes, it's a
Absolutely,
fantastic
and it's
group.
a fantastic
They've
Facebook group.
done
And
a
they
lot
had
of
a thread
research.
yesterday. There was a doctor somewhere that was telling the parent that was asking them about medical cannabis, said cannabis stunted growth.
I saw that, and I
growth.
saw your comment on it too. Just because I'm banned doesn't mean I don't read it. But
Well,
yeah, I did see it.
Whole Plant for Autism Facebook group is actually what it is. And they're a fantastic group of moms and dads and families that have utilized cannabis, and the experience of these parents. And, we talk about moms, but dads do it too. But Ruta, the oils they mix and the terpenes they pay attention to, the minor cannabinoids that they use, those that have nothing to do with intoxication, those acidic cannabinoids, CBD, which doesn't intoxicate anyway, but even the acidic form of CBD, CBDA. Yep. So these are things that we need to break down the wall of research so these parents have this available to them. As Cher said,
it has to be brought down, like, also though, to the level of the pediatricians.
It does. Anyway, so
pediatricians they're a big wall.
I have an entire lecture called How to Talk to Your Doctor About Medical Cannabis. Surely the pediatric population, a very difficult topic to bring up with your pediatrician. But how I recommend that people approach it is to make it third person. Don't include yourself or what you're doing with your child yet until, and listen, I advise everybody, even if you're using, this is very important, even if you're just using a CBD product, okay, completely non-intoxicating, we want you to get that through the MMTC world so it's purified, right, tested appropriately. But legally, even if it's just a CBD product, you still need to get a card legally. You do.
Yeah. And that's every medical state.
You do, but here's the point. So even if you're already using CBD on your child, if you want to see how your pediatrician feels, just leave yourself out of it and say, how do you feel about medical cannabis for autism spectrum disorder? Do you have any patients, not any other patients, okay? Do you have any patients that are utilizing medical cannabis successfully? That gives you the opportunity for him to give you the answer back. We don't want to hear the answer. Pot, weed, dope, grass, it's a drug, wouldn't ever consider it, can't believe it, gonna stunt growth, okay, all this nonsense type of garbage.
Right.
You know what, if that's the way that doctor feels, but you like that doctor for other purposes, then you know what, you're going to probably shut up and continue to use that doctor for all the great things that he does for you. The better answer, of course, would be, you know what, I just don't know about it. They didn't teach me in med school. I know people are doing things about it, but I just don't know. Then you, as the proactive mom or dad that you are, can pull the article out of your pocket and actually hand it to your doctor and say, listen, I'd appreciate it if you read this. And next time we come in, we can talk about it, or I'll call you next week. The third and best answer, hang on, I got to finish because it's my favorite part of the story. The third answer is, we don't do it, but that Dr. Barry over there, okay, we know does it, and he does it with honor and education. So we get a lot of referrals. So anyway.
But we don't have that many children.
No, we don't. No, listen, but we're here to assist our parents, though, with the appropriate advice, right? And we follow the rules. We always do. We always will. But these kids need help. And what they need, see, here's the thing, a lot of these parents are using the white market CBD products, as we call them. They're not lab tested. They're not regulated. We don't know what else is in there, right? And we surely don't want parents buying legacy market cannabis,
No,
right?
yeah.
Believe me, parents in states where there's no access to cannabis,
They're
they
looking
go,
at
they,
us
well, they
for,
go on, they're, listen, they get illegal. They buy it, they make their own oils,
Mhm.
and it's horrible. And I know, Sherry, you've seen the specials, you know, on various documentaries of parents that have had to do
Absolutely.
very, very, very illegal things, unfortunately, to try to get the best care of their kids.
Absolutely.
Shouldn't
I mean,
happen
well,
in this
you
country.
remember before Charlotte's Web came out, like people left the state of Florida, and not just the state of Florida, but like of several states in droves to Colorado. You know what I mean? To have
I
their
had a
children
girlfriend
treated
that did
there.
that. Yeah,
You
she
know?
actually flew there every month to get something for her
Yep.
And you
daughter.
can you
Yeah.
imagine women making decisions now of where they're going to go to college,
Yeah.
or perhaps an
Yeah.
athlete deciding that, you know, hey, I'm not going to go to that state because, you know, God forbid I get a girl pregnant or something. You know, seriously, there's going to be
Yeah.
decisions made in the United
Yeah.
States of
Yeah.
America.
Well, they're not united. That's the problem.
That's going to be just completely,
If they were united,
insane.
we'd have one say all straight across the board.
But I just want to clarify a couple of things when it comes to the care of the autistic child. We always recommend starting with CBD, okay? Recommending that product that doesn't have the THC effect, because there may still be some brain development issues, right?
Right.
With using THC in those under 25 years old. We discuss this, okay? We make sure every parent understands this, okay? But listen, if you have a nonverbal 5-year-old, okay, and the implementation of CBD and a little bit of THC on the underside, and we don't make promises, okay, of verbalization or things like that. That's
Certainly.
snake oil shit, but we've seen it, and
Yeah.
others have seen it too. But the point is, if that little touch of THC opens up some brain parts that to me is a brain development that's positive, not negative. So you need to
Certainly.
respect your patients, respect the plant, and respect the law. And we try to do all three, but we're all going to work hard. Listen, Ohio, I just mentioned, had their autism, turned down as a qualifying condition. There's a gal up in Ohio who has worked tirelessly, relentlessly, put together over 500 pages, 4 years in a row. She's almost had, and the medical board actually nixed it again. So
Well,
it is the doctors,
It's the
Ruta.
doctors.
You're right.
I was at a conference
So frustrating.
with John Hopkins and the physicians of John Hopkins, from the pediatricians to the psychiatrists to cardiologists, all said no way to cannabis. I mean, it was
certainly I've experienced that with psychiatrists as well. So
psychiatrists too. Absolutely. Yeah,
they want
they're
research.
also,
They want research, and we all want research, so
Yeah.
it's kind of a catch-22.
It
So
is.
we have to rely on other countries, to a certain extent, but
Till this opens up someday, because like right now, it is, and I think that's one of the hardest parts, I think, for parents, and even Dr. Berger, like he says it himself, like a lot, they take him on as a full pediatrician just because of his holistic approach, but I mean, he's an outlier. A lot of pediatricians do not agree with him and his methods and
right.
and doing a holistic approach, but he's had a tremendous success, actually.
Sure.
And he has, I mean, hundreds and hundreds of kids.
Yeah, I mean, he's based in Tampa, and he's got patients all over Sarasota and Venice and our area. You know what I mean?
All over.
Yeah.
And he is doing some research. I spoke with him a couple months ago, and it's nice that he's actually working now and trying to do some actual like physical research where they actually can have documentation and provide data now, because he said too, he goes, without the data, he goes, you can talk till you're blue in the face and no one's going to listen to you. And it's a catch-22 again, because there's no funding for it. So unless you're individually able to do it, it's really a rough battle.
So I know we're going to see somewhere politically over the next couple weeks, couple months, because we're going to be out there fighting hard. Anything that you want to speak to specifically, that you want to promo, or anything that you're up to specifically that you want to shout out?
Gosh, I mean, just
no problem. Didn't want to put you on the spot either, but listen.
Tell people to register to vote.
Well, that's true.
Oh yes, definitely.
And there's a primary coming up.
No, the last thing we were supposed to do together was the Fantastic Haven, celebration that got canceled because of COVID. And I had my tux and my mask and the whole bit. So I didn't know if there was anything else coming up.
For sure. Not yet, but I will definitely keep you posted. I'll definitely keep you posted on that for sure. But I just wanted to thank you guys again. And I'm so glad that you guys featured this very, very, very important topic on the show today. I mean, again,
are there any resources that parents can reach out to, Shara, that you would know of? That's a good general resource for people that are really looking,
So
for
honestly,
good
like,
behavioral
you're
therapists?
the one. You're my resource. But I mean, Dr. Berger as well. But I mean, I can't even count. I probably most of my clients I brought to Dr. Berry at some point or another, and their families. So Dr. Berry now sees several of my clients, and then some of their siblings, and maybe their parents as well. You know what I mean? So,
And as we discussed, one of my motivations is having your expertise in monitoring these patients
yes,
as we
yes,
go forward. That's one thing that you provide that we can never provide, because you live in the world day to day with your clients, your patients, your
for sure.
friends, your family, as I know they
Yeah,
become to you.
And
you
what do
know.
you
yeah.
recommend, like, say for a family that might be listening today, because we do have numerous viewers, like say they think their child has autism and they're local
It's a
here.
great question.
Like where do they go?
Where do you
'Cause
start?
Where do you start even? Because I'm sure
So
they're scared and frustrated.
absolutely. And that is true. There's no manual when your child is born with autism. You don't know what to do. A lot of parents don't know what to do. The most important thing is to get that diagnosis early on, as early as possible. As soon as you start seeing signs that they might not be developing typically, hitting the milestones they need to make, you want to get that child to a neurologist or a psychiatrist. Typically, those are the two doctors that can diagnose. They have the diagnostic tools and the tests and that sort of thing to diagnose autism. So one of those, and that's typically who most ABA providers and OT, providers and speech pathologists, because typically you're going to end up working with a lot of different kinds of therapists and insurance companies. They take, you got to go deal with the insurance companies. They will only take the evaluations from a psychiatrist or a neurologist. So there are several in the area. A lot of my clients, regardless, still go to All Children's. All Children's is fantastic. It is in St. Pete, but they do have a huge staff. So you have it's going to be, there's still typically a wait to get in, probably a few month wait to be seen. But if you can get there, I would say get there. Otherwise, look, Dr. Portman, he's a local neurologist. He's in Lakewood Ranch. He's pretty good reputation wise, and then just any of your local psychiatrists. But you just want to do it. The key is to do it as soon as possible and get that diagnosis right away, and then get started on those therapies right away.
Awesome.
Yep.
Well, I know that we're out of time because Don.
Well,
gave me
the
a
green
signal,
rooms go
yeah,
so
we're
fast. That's for sure.
Flies when you're having fun, huh?
I know, but Cher, thank you. You gave a lot of insight, and it's a pleasure
Great.
having you on.
Yeah, I'm so glad that you guys had me on. I totally appreciate the opportunity. And
No,
like
I'll have you on
said,
again. I love the background too. So that's
this
Sarasota stuff.
this is me. I'm in my son's room because
I
everybody
figured,
else, he's at work and everybody else is asleep. So I'm like, okay, my office is in my bedroom, and Billy, he's still sleeping. So
Awesome. See you soon.
See everyone
all right,
next
you
week,
take care, guys. Thank
See you
you
next
so
week.
much.